Saki mbwembwe na kwele mchele kwa kuku kumwaga. Sako na wapenda yatusema nitasikia.
Hello, my name is Dr. Harrieth Gabone-Mwalupindi. First of all, I would like to thank you, Ms. Auntie Mache, for inviting me to come and share my passion. And thank you for giving me this opportunity to participate in Unite Passion Project. I will give you a little background about myself. I'm currently the nursing professor here at South University, West Palm Beach in Florida in US. Originally I'm from Tanzania, born and raised in Shinyanga. My parents are from Bukoba, Kagera. I went to ordinary secondary school and A-level at Welwel Secondary School in Moshi. And then after that, I went to national service in Makutupora, Dodoma. After that, I came to United States, had an opportunity to go to school and study nursing. So I did my bachelor in nursing from Binghamton University, New York. After that, I've been working for 20 years as a nurse and working initially in med-surg floor, and then I started working at the labor and delivery, pregnant women and newborn and pediatric units. And that's my passion. I love to teach. I love to work with patients. And so that's the part when I was working with nurses, new nurses at the Unity and working with patients, I realized that I love to teach. So I went and get my master's in nursing education in Fort Walton University. And then after that, working as a nursing clinical educator, I realized that teaching a patient and making sure the patient understand their diagnosis while they're in the hospital, it will help them when they go home. They will have knowledge of how to take care of themselves so they stay healthy at home. And having that opportunity, I decided to go back to, again, to get my PhD and be able to get more research background of all this education to make sure it's effective for the patients and make sure we address things like mortality, maternal mortality or newborn mortality. So those are the things that I'm interested in doing. So after I finished my school, I came to vacation back home to see my family. And then one of my family members was sick, and during the inquiry of finding out what she knows about her diagnosis and what things they need to do, I realized she did not have that much information about what she needs to do and understanding exactly what she was told about from the doctor's office. So for the knowledge I have, and I've been working as a nursing clinical educator for more than 10 years, I realized that I need to go back and work with some of the hospitals to be able to share what I know and what we can do to educate our patients, so the more they know what is going on with their body, they'll be able to improve their health practices and then stay away from the hospitals. So I got an opportunity to talk to one of the board of directors in Dodoma Medical Center, and luckily he was interested in also in improving nursing clinical practice and medical clinical practice also. So we had that communication, and then in 2017, 2018, I came to the hospital and talked to the nurses and doctors and finding out what they know, what they needs, and what their education needs and knowledge gaps that they're, and then we can share with what I do here in the United States. And that time I was working at one of the hospital in Ohio. So when I came back in 2018, I realized working by myself is not going to be enough. And I recruited 5 of, other expertise here from the United States to come and back to Tanzania and work with them. So there was 5 of us who came last year, 2019, for our first pilot medical mission. And we were able to go and do education and training with nurses and doctors and other healthcare workers. And also, one of our community projects, we included working with the student at one of the primary school, and we were focusing on 2 areas of health promotion, which one of them was hand washing, and how often should they wash and what are the correct technique of doing it. And then another one was the dental hygiene, just to make sure they know when should they brush their teeth, and how often should they brush their teeth, and what should they use to brush their teeth. So those basic education, health promotion activities also come in handy. Like now we know about corona, one of the preventative measures was hand washing. So we were blessed to have that opportunity to work with a student last year. And unfortunately, we were planning to do another trip to come this year. With this corona, COVID-19, we were not able to come this year. So we decided to do other things, long distance training via Zoom, and we're doing some donation to bring back home to those children at the school. So as we came back last year, we realized that only 5 people is not going to be enough. So we have to come and bring more people to come and educate in even more than one hospital. So I am currently founder and president of Dr. Gabone QHSC, which is quite healthcare solution and consulting. And so our goals and our mission is to come and educate and train healthcare providers in Tanzania. And it's not only bound to one hospital, so we're going to try to do as much as we can slowly and try to share what we know and learn from our colleagues in Tanzania to help each other to make sure we improve clinical practice and patient care at the hospital. And also we're planning to do some community outreach also. One of them is to continue doing with the hospitals in, healthcare attendants in the villages, and also schools to try and do health promotion. Because we believe if the community is educated enough, they'll be able to take care of themselves and improve their health care practices and prevent diseases. So to put all this in perspective, as a young girl, I always like to care. I always care for other people, especially if somebody is sick. So then I found my passion in nursing. And I love working as a nurse, and there's a lot of opportunities working as a nurse at the hospital, working as a nurse beyond the hospitals, and go in the community to try and improve the health of our communities. So I will encourage you as young scholars now, find your passion, find something that gives you the excitement, give you the strength to say, I need to do something for myself, my family, and my community. And so one of the questions you should ask yourself, if you choose a certain career you want to do, is it for yourself? Is it for the community? Or is it for your family? And then so when you get an opportunity, you find a mentor, somebody who's done that area of interest, and then seek for opportunities to learn and find out if you can do similar things. There will be challenges, but you have to make sure you're dedicated enough, work as hard as you can, study as hard as you can, and if there's any struggles, reach out and try to find an opportunity for somebody to help you. So those are just my thoughts, and I will encourage you to continue pursue your dreams, and even if there's some challenges, try to work as hard as you can, and then I pray that you will be successful from your effort. So I wish you well, and congratulations for all the scholars. And just remember, once you get those opportunities, remember to pay back and go back to your communities and help them and help somebody else who is behind, and so they can better themselves and better their life and eventually help their community to improve. So again, thank you for the opportunity to come and share my passion. And for those who are interested to be nurses, you can reach over and we can come and compare our notes and see how much we can help each other. So good luck and may God bless you. Bye.
Ipaga moyo nikianza kulia chozi nafutia.